So now we have the three most high yield rods in the gram positive. So gram positive rod, first we have the bacilli, bacillus or bacilli part, and bacilli gram positive, it is rod and it is the spore forming bacteria. So it has two different types, bacillus cereus and bacillus uh, anthracis. So first one is bacilli anthracis, and this bacilli anthracis is pretty much lethal because it has three different factors which can causes problem: lethal factor, edema factor, and protective antigen. First, it has the poly D glutamate peptide, which is a peptide, polypeptide capsule, and this capsule is very much important in the anti-phagocytic activity. So polyglutamate capsule, which gives it medusae like multiple medusae head like appearance. It's the clue in the scenario, appears in the scenario. So bacilli anthracis releases protective factor, protective antigen. It releases lethal factor, and this lethal factor, it can causes it is a zinc protease. It causes inhibition of the signaling pathway MAP kinase. Once the signaling pathway is impaired, then the cell doesn't signal anything to the body defense system. So this is the first step in order to evade that phagocytic activity, in order to evade the body immune response. Then it releases edema factor, and this edema factor is pretty much like pertussis, and it increases camp, which obviously immobile or dysfunction the neutrophils. So after causing this, how this spread? It spread from aerosols. It has two different species. It spread from aerosol, and especially from the person which are dealing with wool animal farm. So it is also called wool sorter disease. So in the cutaneous, if the person is immunocompetent, or if the person has a cutaneous contact with this bacilli, then it can cause a painless papule having a vesicular border, and this papule, after contact with the skin, it evade phagosomes, and then it inhibit their pathways and increase camp and causes neutrophil dysfunction. After being anti-phagocytic, it can causes skin infection, which is pretty much black. The skin infection, which is pretty much black, necrotic center, necrotic ulcer, and black necrotic ulcer with a black necrotic center, also known as scar. So if the person inhale this bacilli, then it goes into the lungs, and first it causes flu-like symptoms, which is rapidly progress to high fever, pulmonary hemorrhage, and and these bacteria goes to the mediastinal lymph node. Over there it can cause mediastinitis. On the CXR we can see a widened mediastinum. So this is a bioterrorism weapon, bioterrorism bioweapon, and used in some kind of world wars as a meal, contaminated meal. So the soldiers having this pulmonary hemorrhage type of infection. So how to treat this anthracis part? We just give for anthracis we give post exposure prophylactically give cipro and doxy, cipro or doxycycline. So next the bacilli. This is the Bacillus anthracis. Now the Bacillus cereus or Bacillus cereus, it is causing food poisoning syndrome, also known as reheated rice syndrome. Very much common because the bacilli love these carbohydrate rich meals, and in they release spore which germinate and causes this food poisoning by their enterotoxins. So it has two type: emetic type or vomiting predominant, or it has diarrheal type or diarrhea predominant type. Emetic type is caused by cerulide toxin which is preformed and causes the acute onset within the 1 to 5 hours of after consumption, causes the vomiting type of food poisoning. Then we have the diarrheal part. The diarrheal part is very much by the preformed enterotoxin, and it is very much late onset, like 8 to 18 hours, causing the pain, abdominal pain and watery diarrhea. So treatment is only supportive treatment, just no need to give any kind of medication. So this is a Bacilli cereus and Bacilli anthracis. The next one we have Corynebacterium. So next aerobic gram positive rod is Corynebacterium diphtheria. Corynebacterium diphtheria is a club shaped bacterium, and it can cause diphtheria. So the risk factor is the person which is unvaccinated or having no booster in their lifetime are very much risk factors for developing Corynebacterium diphtheria. And if the person is unvaccinated or having no booster, then the Corynebacterium releases its toxin known as diphtheria toxin. Diphtheria toxin via respiratory aerosols. Why? Because it colonizes in the respiratory tract, and if the person is unvaccinated, not protected, non-booster, then this colony goes into the respiratory tract and causing diphtheria, pseudo membranous pharyngitis. So this is a droplet transmission diphtheria via diphtheria toxin. So this toxin or diphtheria toxin, when this goes into the cell, this toxin can inhibit elongation factor 2, ADP, ribosylation, and causes necrosis of the cell. And this toxin is very much encoded by the beta prophage encoded toxin. So beta prophage, we will discuss this in the viral genetics part. So this necrosis happen in the pharynx and causes pseudo membranous pharyngitis with the bull neck lymphadenopathy. And if this pharyngitis is not properly treated, then it can complicate or disseminate, goes into the heart, causes myocarditis and arrhythmia, goes to the CNS, spread to the CNS and causes goes to the blood nerve barrier, disseminate into the blood, goes to the blood nerve barrier, penetrate and causes neuropathic or CNS problem. So how to diagnose this Corynebacterium diphtheria? First, if a person is infected, we do ALEC test, which is only for ALEC toxin detecting test. First confirm that this is a diphtheria toxin. Then we give Loeffler's media, which is aniline dye, giving the metachrome, means red blue color of granules, which are actually polyphosphate, the polyphosphate granules. So aniline dye detect these granules, and after aniline we can also do cysteine telluride agar in order to grow, which gives black colonies. So this is how to treat diphtheria. And now how to treat this? So first, it is preventable by diphtheria toxoid vaccine. If a person is exposed, then we give antitoxin, which are the preformed neutralizing antibodies, in order to remove all the toxin from the body. And then we give erythro or penicillin to kill the remaining colonies in the nasopharynx. So this is how to treat and how to diagnose diphtheria, Corynebacterium diphtheria. And then the last one is Listeria. Listeria is a gram-positive, again the same gram-positive rod, but it is facultative. So how Listeria transmit? So there are three different mode of transmissions of Listeria. We'll discuss them one by one. First one is Listeria is a facultative intracellular pathogen, which means that it evades phagosome. It's a food-borne pathogen, like on the unpastured dairy products, cold meat, deli meat. So what happened is that this Listeria grows on that meat, which is refrigerate at cold temperature. So Listeria is a cold enrichment. It means that it grow at the refrigerator temperature, it grow over there. Now the person consume that unpastured dairy, cheese or cold meat, and now he is suffering from. If he is healthy, then it has febrile gastroenteritis, simple. But if he is immunocompromised, neonate, or any other debilitating condition, then what actually happens? From the intestine, the bacteria release list. Bacteria is now from the intestine. Bacteria goes into the cell and go taken up into the cell of enterocyte and taken up by the macrophages, and over there it can release listeriolysin O, which is a pore making toxin into the phagosomes. And once it made pores into the phagosome, it spread intracellularly and also from cell to cell. So it's the mode of spread how listeria happen. Then listeria has a hijacking mechanism. It hijack host actin polymerization and to make rocket tail, and this rocket tail actin polymerization actually helps the bacteria to move from one cell to another, because if we grow this bacteria, we will see a tumbling motility on broth agar because of this rocket tail. So now bacteria can spread from GIT to any other organ. So if the person is immunocompetent, it can cause only gastroenteritis, febrile gastroenteritis. But if the person is a neonate, first there is so this is the mode of transmission from the food. Now the mode of transmission from the placenta. So when it is separate from placenta, it can cause amnionitis, it can cause abortion, it can cause septicemia in the neonate, which is neonatal respiratory distress, present as neonatal respiratory distress. The next, it can also cause granulomatosis, granuloma making in the infant suffering from septicemia, which is a granuloma and skin problem. So it can it can also spread via birth canal. So if the neonate, if there is a placental transmission, transplacental spread, then it can cause amnionitis, abortion, septicemia. But if the neonate got the infection from the birth canal, then it can cause meningitis, and which is in the neonates, it is the third most common cause of meningitis. And if the person is immunocompromised, then it can also cause meningitis in elders, immunocompromised patient. So this is how listeria causes dissemination from transplacental and birth canal. So Listeria is a gram-positive intracellular. This is how it evades from phagolysosome. It's a foodborne. The mode of transmission is this. So in the healthy individual, it can cause gastritis, but if the immunocompromised, it can cause meningitis and febrile gastroenteritis. Healthy individual, febrile gastroenteritis. If the immunocompromised, can cause meningitis. Then if the birth canal is infected, it can cause neonatal meningitis. If it is transplacental, it can cause amnionitis, abortion, septic neonatal. It has tumbling motility and listeriolysin. So this is all about the listeria gram-positive rod. So we have discussed all the rods of the gram-positive family.